Hi, my name is Sydney Nutma, and I will be going over the diagnosis of leukemia for our pediatric group assignment. So first off, since leukemia is a cancer of the bone marrow stem cells, which are supposed to be developing into your normal red blood cells, white blood cells, and then also platelets, when things aren't developing normally, there are many red flag markers that can help doctors diagnose the different variations of leukemia. So to start things off, a doctor would first go through a physical examination, look for the physical signs of leukemia, such as like pale skin from anemia, swollen lymph nodes, and enlarged liver or spleen. But unfortunately, those signs and symptoms are also the signs and symptoms of so many other disease processes that a doctor can't just rely on a physical examination alone to determine an accurate diagnosis for leukemia. So they're also going to go into more specific testing through blood work. So your doctor would ask for a complete blood count of your white blood cells, your red blood cells, and then also a platelet count to see the abnormal levels, if there are any. Generally with leukemia, you're going to have a higher white blood cell count, so a doctor can look at that and use that as a red flag in helping them diagnose the problem associated with that. They could also go and look for a blood smear or take a blood smear sample and look at the specific characteristics of your blood cells and see if there's any abnormalities going on with like the specific structure, characteristics, how those cells are interacting with each other. Not all leukemia cells circulate in your blood, so that's why doctors will have to go from first off blood testing and then go to specifically bone marrow testing, because some leukemia cells just stay specifically in your bone marrow. So a doctor would take a sample of your bone marrow, biopsy that, send it to a lab, look at, are there leukemia cells present in this? What's going on with your bone marrow? From that, they can do even more specific testing like MRI, CT scans, and whatnot to see if leukemia has spread to any of your surrounding tissues, organs, other areas in your body. The leukemia cells themselves are not going to show up on those scans, but it can help determine the severity of the leukemia if it has infiltrated other places and started causing abnormalities in those structures. A doctor can also go through like a spinal tap procedure and look at your cerebral spinal fluid to see if there's any leukemia cells in that. But those are generally tests done after a doctor's already reached a leukemia diagnosis. It's super important that doctors are able to find the specific kind of leukemia and diagnose it properly so that they can start the right treatment procedures. But anyways, that's a little wrap up on just how leukemia is diagnosed. Thanks for listening.